We are the most rural academic medical center in the country. We are very focused on where can people access our care. So we have 7 organizations that are part of us. We have close to 45 practice sites that allow people to actually access care as close as they can to their home. We have made a huge commitment to telehealth, so all of our face-to-face practice sites are also backed up by a robust telehealth infrastructure. 80% of our behavioral health is delivered virtually. Our no-show rate is almost 0 now because we've identified that people actually want to receive that behavioral health consultation in a place where they're comfortable. Our promise to patients has been that wherever they access Dartmouth Health, they will have access to the full power of our medical and scientific expertise, as well as the full range of our specialists, as well as the infrastructure that allow them to get their care at the time and the place that's most convenient for them. That's a promise that we take very, very seriously. Healthcare is hard. However, people make a difference in patients' and families' lives every single day. I wouldn't have any other job than the job I have right now.